Hello and welcome. We are happy to be a part of your team of healthcare providers. Arizona Kidney Disease and Hypertension Center is the largest nephrologist-owned practice in the nation. We have been helping patients like you since the 1970s, and we are working daily to set the standards of excellence in medical care for patients with hypertension and kidney disease. You have probably been referred to a kidney specialist because your blood work has identified you as having a kidney-related issue that requires specialized analysis and possible treatment. Your kidney specialist here will be working hard to identify the issue and determine prevention and treatment options that best suit you, the patient.
My name is Gloria Lewis, and I am a kidney patient. I have had kidney disease for about 20 years. When I first found out that I had kidney disease, I was very fearful, very fearful. I was afraid. I am on hemodialysis right now. I've been on dialysis for about 20 years. My treatments are 3 times a week, and I go to a dialysis unit, and everyone there is very, very, very polite, very nice. And also the doctors are very confident, and they work with you. And also you have a social worker and a dietitian that works with you also. It's not painful, and you can be very relaxed and very comfortable.
I chose peritoneal dialysis because I thought it'd be more convenient to be at home and basically just to learn, and then I could control things with my own body and do things myself and not have to travel back and forth to the dialysis center. My training was great, and I had 2 excellent nurses for teachers, and it was very interesting. And I learned quite a bit, and I think I'll have very good success at home. Well, yes, I would recommend it to anyone that wants to do things by themselves and monitor themselves, and I think it's much more convenient. I think that's the bottom line with any kidney disease, is to get a kidney replacement. And I think I'm in a healthy enough position to do that.
Welcome. We know you may be anxious to find out more about why you've been referred, and we're happy to provide these videos so you can learn more about your body, your kidneys, and what we can do to help you. This video has been selected because you've been identified as having either stage 4 or 5 chronic kidney disease. This means that your level of kidney function has declined below 30%. At this stage, our concerns are focused on slowing the progression of kidney disease and preparation for renal replacement options. You may begin to feel some symptoms related to your kidney disease. To replace the kidney's function once it deteriorates to the level where electrolyte management, toxin clearance, or urine output declines to a level where you start to feel tired, have difficulty focusing, poor appetite, or declining nutritional status, and uncontrollable swelling or shortness of breath from fluid overload, it is important to begin some form of replacement therapy. First, if your age and health permits, you may be referred to a transplant center for evaluation. The wait list is long for a kidney transplant from a deceased donor, and so it is best to begin the workup as soon as your blood work indicates your kidney function has declined below 20%. If you are healthy enough and have a living donor available, and they are deemed healthy enough to donate, this is a wonderful option that can occur much, much sooner, sometimes within 6 months. Once transplanted, you will need to stay on medications to suppress your immune system from rejecting the transplant. If you're waiting for a transplant, or if you're not a candidate for transplant but need renal replacement therapy, there are wonderful options still. Remember, the kidney is primarily a filter, and its main job is to filter and clean your blood and remove waste and water. So if we need to replace its declining function, we need an artificial filter. Options include forms of home dialysis. This includes peritoneal dialysis and home hemodialysis. Peritoneal dialysis is an indirect way to clean your blood. To indirectly clean your blood, we must place an access that involves a surgical excision of a peritoneal catheter into the abdominal cavity. The membrane that lines the organs of the abdominal wall serves as the filter. After the catheter is inserted, it takes about 4 to 6 weeks to heal and seal so there's no leakage. Then you'll be instructed on the care and use of the catheter. Typically, a fluid called a dianyl, which is a sterile solution of electrolytes and glucose, is infused over a set period of time. A set volume, usually 2 to 2.5 liters of dianyl, is allowed to dwell in your abdominal cavity for 4 to 6 hours and then is drained out. This occurs 4 times a day. We teach you how to do this safely at home by yourself or with a partner, and we encourage your family members to train with you so they can help and support you in this function. Professional assistance is only a phone call away and available 24 hours a day. Most patients are candidates for a nighttime cycler that then exchanges while they sleep, leaving them only to do one manual exchange midday. Hemodialysis involves the direct cleaning of your blood. This can be done at centers that are widely dispersed or at home by you and your family with 24-hour-a-day assistance available. To directly clean your blood, you must have an access. An access allows access to your blood, so we can bring it to the machine, clean it, and return it to your body. Preparation for an access includes the timely mapping of your arteries and veins in your arm. When you are 9 to 12 months from needing dialysis, an access can be created surgically. If the veins and arteries are large enough, they can be directly connected in a minor surgery to create a fistula. Over time, usually 2 to 6 months, this arteriovenous fistula will mature, and under the pressure of the arterial vessels, the vein will get bigger. The vein will then be able to be directly accessed by needles to draw blood from your body, clean it, and a separate needle is then placed close to the first to return the blood. If the vein and artery in the arms are too small, then an access can be created by connecting the vein first to the man-made tube or graft, and then to the artery. This arteriovenous graft heals faster and is fully matured. The downside is that the graft is a foreign body and can get infected more often than the fistula. If your hemodialysis access is not yet matured or ready for use, but you need dialysis, then a catheter is placed. A catheter is a large IV placed in a large vessel, usually in your neck or rarely in your upper chest. Temporary catheters are not intended for long-term use, but semi-permanent access can be tunneled underneath your skin to minimize the risk of infection. In general, this is not the ideal access, as it has a high risk for infection and failure. Every effort should be made to avoid catheters with proper preparation and planning. Thank you for taking this time to learn more about renal replacement options or replacement modalities. You, your nephrologist, and primary care doctor are working as a team to make sure you preserve your kidney function over time. If and when renal replacement therapy is necessary, we will work together to properly prepare you for the modality of your choice. We also encourage you to obtain transplant workup if you are healthy enough to, and to talk to your family about home dialysis options like peritoneal dialysis and home hemodialysis. Obtaining timely vessel mapping and access creation are key to reducing your risk of infection and complications on hemodialysis. We welcome you to attend informational classes and individualized one-on-one sessions about your modality options.
I would like to tell the patients and the people that have been told that they have need dialysis, that have end-stage renal disease, to listen to your doctor. Talk things over with your doctor. Be ready to take heed to what your doctor is telling you, because it's very important that you take good care of your body and to get started on dialysis right away.
I was blessed 22 years ago with a transplant on January 17th, 87, and I have a picture of my kidney right here. So I still have 2 kidneys that I carry around with. His name is Sammy, and then the back is the date is 1/17/87. So I'm really blessed and grateful to God.
We hope this video has helped remove some of the mysteries of what your kidneys do. A word to the wise: follow as scheduled with your primary care doctor, nephrologist, and other specialists. Routine lab work will likely be necessary before each visit with us. We will carefully explain any special test or X-ray imaging we request of you. We will be monitoring your lab work routinely for any indication that you may need tests or new treatments. We encourage you to meet with our registered dietitian to answer questions about your diet in relation to your kidneys. Together, you, your primary care, and your subspecialist, including nephrologist, can ensure your success. Thank you for taking the time to help us care for you.